Welcome to the vlog post. For the blog post, MRD is the goal for multiple myeloma, at least according to Dr. Rafael Fonseca. I believe Dr. Fonseca practices at the Mayo Clinic in Phoenix, Arizona. To begin with, MRD, minimal residual disease, is a diagnostic term offered by some myeloma centers. It's not at all widespread. There was a time when it used to just be complete remission or partial remission. Now there are more fine-tuning of our myeloma after we undergo therapy. So after your induction therapy, for example, or after your autologous stem cell transplant, or even after maintenance therapy, your oncologist may come to you and say, you have reached MRD negative. He or she might say, you have reached MRD positive. All of these are diagnostic levels, measurements of how many myeloma cells, bad myeloma cells, are amongst your bone marrow cells. MRD negative is the best, is the least amount of myeloma. This is good. For the sake of definition, MRD negative status means means one bad myeloma cell for every 1 million, 10 to the 6, 1 million bone marrow cells. That's a teeny amount of myeloma. That's great. The question is, what do you, the patient, do if you've achieved this status, this level of myeloma? The short answer is that conventional myeloma oncology hasn't yet made a definite connection with MRD negative status and a longer progression-free survival or a longer length of life, overall survival. There's an association. You can hope for a longer remission, perhaps a longer overall survival, but it's not yet clearly established. Certainly take MRD negative status into your mind when deciding your next therapy steps. It's possible and feel free to email me if you're watching this vlog on beating myeloma. Scroll to the bottom of the page, write me an email. We'll talk. If you're watching this on YouTube, click the link to People Beating Cancer. Talk to me. The question is, what do you do? It's possible that you might not need more therapy at this point. As we know, toxicity usually translates into damage. So, give serious consideration, especially if you have reached MRD negative status after your induction therapy, 3, 4, 5 rounds of a doublet, triplet, etc. Consider not undergoing therapy at this point for some period of time. The point of the article linked below is that Dr. Fonseca is essentially quoted as saying, we myeloma patients are doing well to reach such a teeny amount of myeloma. Personally, because I believe in the benefit, the power of anti-myeloma nutrition, supplementation, lifestyle, those are non-toxic therapies, and I believe that the patient who reaches MRD negative or positive, that's the time to pursue non-toxic, evidence-based, but non-toxic anti-myeloma therapies. Again, if you want to discuss those, send me an email. So, minimal residual disease, it is a diagnostic term, similar or in the past, there were levels such as complete remission, stringent complete remission, very good partial remission, remission. All of this is an indicator as to where you go, where your steps are for therapies going forward. If you have any more questions, let me know. Thank you for your time.